we launched the Houston Free Market Medical Association chapter. So this was our first event. We had 4 speakers, great speakers, and a great turnout. We had close to 100 people come, and a lot of interest. And I think the timing of what we are doing, what FMMA is doing, is so perfect. And so we want to bring that model to Houston.
It's really exciting to see the Houston Free Market Medical Association coming together and bringing all of these concerns to light. A lot of these are business owners who really are paying a big price for healthcare premium. They do not know what to do to bring these premiums down and to make sure their employees are covered. So we have some solutions, we have some ideas. It's great to see the energy, the interest, and the coming together of bright like minds to make a difference.
What will be exciting is we want to collaborate together as chapters and hopefully make changes at the state level legislatively to promote some of these free market concepts. And this grassroots movement will basically overhaul our healthcare system. And I think that transition is now starting to happen faster and faster.
The situation is sort of like, you know, in the old days, there was the patient and the physician in the room, and that worked great. But then you now have this point where it's like the analogy I draw is, you know those old things in the 60s and 70s where they jam a bunch of people in a phone booth? Exam rooms are like that. There's all these other people who aren't really doing anything to make the patient any healthier. There's hospital administrators and insurance companies and billers and all these things that are crammed in there, and you know, crammed into that discussion, and it's really impaired the ability for doctors to be doctors and patients to get the full value out of that relationship that they have with the doctor. So it's fixing that, you know, getting that back, you know, with a modern approach, but getting that relationship going again. You kind of have maybe 3 generations. There's like the folks like Keith Smith who've been doing it a while and long enough where they've actually hit their stride, making, you know, great practice, great business. There's the ones who are relatively new and really, you know, learning from each other and really excited. And then there's the ones sort of on the periphery, like, you know, they're ready to dip their toe in the water, but they want to learn more and see what it's all about. Is it possible? Yeah, so I mean, it tends to be in those 3 camps.
We're introducing a free market approach into Austin that no one is really aware of. Now, I think there were quite a few people in Dallas or North Texas that had heard about the Oklahoma miracle, right? But as you can tell from Houston as well, we're kind of like in the hinterlands when it comes to the free market. So that's been one. We've had some curiosity, folks, the first couple meetings, but since that time, it's really gotten down to a couple of TPAs that are active in the free market, and then some employers that are looking to do some innovative things, but most of all, it's providers. I think going forward, what we'd really like to see more of is employers. Okay, we'd really like to see some governmental folks. So I don't think this is going to be a supply problem. I do think it's going to be a demand problem, because most of those employers are hidden behind the wall of either consultants who are keeping them in the dark, or just simply don't know about the free market and the impact to the healthcare spending, or they're stuck in the health plan mentality. The principles as outlined by the Free Market Medical Association are really the touchstones for everyone. What I see coming in Austin, what we really need to get to, we need to get to the middle market. We need to get to the 200 to 2,000 employee market, primarily because most of those businesses are managed and owned by individuals or families or a couple people, partners, for instance. And they're the ones that are actually really impacted by all this healthcare mess, and they have no leverage. So when the annual renewal comes up and they get a 15% increase, what can they do? Nothing, right? And so they feel like they don't have any options. What we're really looking to try to do is be that kind of solution, just like Keith is, where we're taking things out of the really expensive hospital systems, the routine things, and we're taking them to lower cost sites of service. We've had to seed the market in Austin. We're very fortunate that the people who cut the weight before us, like Jay and Keith, people like that who've really been pushing the envelope, have really brought some awareness to us to people that are in their sphere of influence or even outside of, and it's really helped a whole lot.